Acupuncture manipulates qi and blood at the points, that they are like gates. Think of the meridians as pathways of qi and blood, and that the points are like gates, and that the needles are supposed to like open and close them. Of course, with the benefit of modern science, since the 70s, there have been so many studies that explain, even on a cellular and genetic level, how acupuncture works. Acupuncture works by provoking a reaction. So when you put a needle in a particular point, you have a local reaction. It becomes red because blood rushes to the area. Now, on a more spinal level, because all the nerves in our body, at least from the neck down, they have to go to our brain through the spinal cord. By putting a needle here, signal is transmitted to the spinal cord, and then there's a reflex that goes back. But instead of moving or jerking away, it's a reflex to mediate the pain sensation, to release appropriate neurotransmitters and blood messenger proteins to mediate the problem. So that's how we get the therapeutic effect. And lastly, because you feel something, it goes all the way to the brain. There's a part of the brain which processes all sensory input. Parang censoring board. And right beside that is the Department of Hormones, Circadian Rhythm, Day-Night Cycle. So since they're all magkakatabi, hypothetically influencing that part can influence such things as sleep, hormone production.
The World Health Organization has strongly endorsed acupuncture for treatment of three main types of illnesses, namely neuromuscular disorders, gastrointestinal problems, and even gynecological disorders.
So here we are. This is a typical acupuncture session, and I'd like to explain more or less what a patient can expect. Now, this is of course after we do our history and physical examination. And of course, in a patient with low back pain, we try to determine the kind of pain, the cause of the pain, and then we customize our treatment accordingly. Sometimes we bombard the whole affected area with needles. Sometimes we use needles away. But for most patients, you can expect a combination of needles on the affected area and needles away from the affected area. Many people are afraid of needles due to our experiences being vaccinated. The difference between those needles and acupuncture needles is profound. First, may I? You can see that I'll take one out. The acupuncture needle is quite thin and bendy, as you can see. So unless you even know how to put it in, it's hard to put in. Obviously, the first thing we do is make sure the area is clean. Once the point is located, tap it really quick, and as you can see, insertion to a depth of about 1 centimeter has been done, and the patient has not felt anything. So once the needle is in, we have what we call what is known as the chi sensation, usually described as heavy or electric. Like when you bang your elbow at may kumukuryente sa kamay, that's the usual feeling. Now, if the acupuncturist does not communicate that to the patient, sometimes they interpret it as, akala ko ba walang sakit? So communication is important. So insertion of the needle and manipulation. So I'm now lifting and thrusting. Sometimes I could twirl, I could stroke, so many different effects. Some other times we also add electric machines to make it vibrate more. Chinese medicine is not better than Western medicine, period. It may be better at some things, Western medicine better at some things, and then you promote cooperation. And when people see results, they can't argue with results. But before they see results, they must be willing to try, and to be honest, doctors must suggest it to them. Acupuncture and medicines only help speed things up. To effect a permanent cure, the patient must change his lifestyle and adapt to nature and keep from being too stressed.